Well, hello all, welcome to week 7. So the topic for this week, a really important topic as we kind of continue through this hodgepodge of topics, it feels like, in the capstone, but it's probably a good way to do a capstone course is just throw everything in you didn't have time for throughout the program. Professionalism is something that we don't explicitly talk about a great deal within the program, although I think we address it in many ways in other courses, and particularly I think in the health and wellness coaching concentration. It comes up a few times in there, especially when we're on campus together. But we felt it was important to at least put a module in here for the capstone experience so that it feels like as everyone is getting ready to embark on the rest of your journey after the integrative health and wellness program, that having some sort of conversation about what professionalism means in the context of what we're studying, we feel like it's really important. And so this is why we put it in for not just touching on it within a module of a separate topic or a larger topic or a different topic, but as its own topic. And so I think there are many things we can probably talk about here. And to be fair, it's probably professionalism has a very personal spin to it. I think it's something that is unique in some ways to each of us because it really ties to our own personalities and our own way we relate to other people. And I think it has something to do with also the way we conduct ourselves within our personal relationships, within our professional relationships as well. So, there are many ways we could go with this, and each of you have a great deal to say about this topic, and that's, I think, the kind of the neat part about talking about it in general is that there's a lot of directions we could go. I think, first of all, there's a relatively short video series that University of Arizona put together relative to professionalism that we've got for this week to watch. But there's also, I think, what we've done reading Heroic Living throughout the course is also tied in many ways of what this is like. And that's really where I wanted to go with this is yes, it's important to make sure that we're presentable in that the way we dress and the words that we use, the atmosphere we create, whether it's in person or online. All of those things, of course, are important for professionalism, to make sure we're conducting ourselves at a standard that makes others feel comfortable and certainly makes others feel confident that we're able to do our job in the way they hope that we can do it. And there's a lot of ways we could go with it. There's a lot of particular nuances with that, but I think other people cover those topics of the way you dress and, making sure that your hair is combed and, like mine is. But I'd really like to go a different direction there. And there are other parts to professionalism, at least in my thoughts about it, that are important to also discuss. And that really is the way we carry ourselves in our personal relationships and how we make others feel when we're meeting with them. And some of the things that we talk about within this program, I think are tied into this professionalism piece, even if we don't say them explicitly. Like, for instance, maybe one of the things that comes to the top of the list for me would be this idea that health and wellness coaching or anything health and wellness related or personal health related is tied to an achievement. I think it's a really important topic for us to talk about for just a moment. So most of how we've been conditioned within our acceptable culture of the United States is that achievement is held in very high regard, and it is certainly what we base our entire academic system on. Is that you as an individual, me as an individual, are graded quite literally, giving marks on a scale of our performance, and if those marks are high enough, then we get accolades for them and we get praised for them. And if they're not high enough, then we most of the time get the opposite, that we're not doing enough or we're not good enough, and it's very much tied to our personal, person, who I am as an individual or who you are as an individual. And I think it's important for us to think about what this means in the context of working with another individual relative to their health, because this is very much the same. If, for instance, you're working with a person that is of normal body weight, maybe is athletic, is able to do 10K run or a marathon, and maybe even be able to do it at a really quick pace relative to their age. Maybe their blood pressure is under control and their blood sugar is where it's supposed to be, and then adding on, well, they maybe they eat really well according to the guidelines, that all kinds of hitting the numbers for fruits and vegetables, and not getting not eating very much sugar, and largely plant-based. And when we have those types of folks that we're working with, it's really easy to say, wow, you are awesome, you are really just doing great, and it's all about their performance. And so we tie together who they are as an individual with what they're doing in their personal health behaviors, and making them really one and the same. I think our education system does that. I think our whole youth sports system, and as it carries into adulthood sports system, does that. I think our job performance is very similar and tied to that. And I think it's part of our professionalism conversation to make sure that when we relate to the folks that we're working with, that we make sure that they understand that who they are as an individual is something that is different, although certainly related to what they're doing as in their performance, but they are not the same, in that you as a person, me as a person, shouldn't be scaled based upon our body weight or any other measurement, grade point average or getting A's and B's, but we're conditioned to be that way. And so the messaging that we give and exchange, I think is maybe a good way to say it, with our patients and clients, should be one that values them as an individual first and foremost, them as a person, as a human, and that the root of their humanness is always in a good place, and that the context of their achievements, although notable, it doesn't mean that we wouldn't or shouldn't give appropriate praise and accolades and encouragement, certainly for jobs well done. That isn't the what I'm saying. What I'm hoping you're hearing is that we value them as an individual first, and then and how we have our conversations and how we say our words and how we carry ourselves within those conversations is going to deliver a message to them that sometimes always isn't explicit in the words that we say. So I just want you to think perhaps about that and consider that as part of your professionalism and who you are as a professional in this, in whatever you end up doing, for a job for this, whether it's in healthcare or health, traditional healthcare setting, or in a health and wellness setting, or community setting, or employers, or whatever that looks like for you. But consider how those exchanges happen for you when you're talking with a patient or client. And I think that's a really important part of our professionalism. As the old, I'm going to get the phrase not exactly right, but it's really more important for how we make people feel rather than what we do for them. And if we can, make people feel like they're valued as a person first, rather than only valued if they can perform at a certain level, then I think you're going to make a difference, regardless of outcome. And I think it's also maybe worth noting too, and I perhaps have mentioned this in other ways, maybe even in this class, that this whole thing that you're doing in integrative health and wellness, and the jobs that you're already doing and hope to do in the future, these aren't about you. When you decide to get into a profession that is one that serves others, you have to leave that part behind. There isn't anything that's about you that you're going to do, or that you're already doing. When you work with a patient and client, this isn't about how your metrics can look. This is about the individual that you're working with, and what they need at the time, and whether that makes you look like you know what you're doing, or makes you look like the fool, doesn't matter. It's all about the individual that you're working with. And so I say that, and it might be like, wow, that's sort of obvious, but it's not. I can guarantee you it's not obvious to everyone. And I remember back in some early days for me that was very difficult, where the future of our program depended on how the metrics were going to turn out. And so when I started focusing more about the numbers and the outcomes that people were getting, rather than them as an individual, that's when things start to turn south. And I'm a firm believer in that if you focus on the right perspective, the right way to work with an individual, with them as a person first, then everything else follows after that, as it should. And the numbers they fall where they may, and they are what they are. And so there's been many times where our program's been criticized for many things, particularly within the metric side of things. But I don't think there's been a time, at least not the one that I'm aware of or that I know of, where someone hasn't been treated as a person first. And that is always something that I'm very happy with. And that I think that continues to make us move forward in the right way, with the best of intentions. Those are professionalism issues for me, and that are really important professionalism issues for me. And of course, you can look at professionalism as a way of how well did I articulate this message to you in this video, and did I use the right language, and did I not say very many ums and knows and whatever, and that is certainly important, but it's also, in my mind, not the most important thing. It's the message itself and the intention of it, and that goes a long way when you're working with the patients and clients that rely on you for a purpose. They're there for a purpose. They're not necessarily, most people aren't there to be impressed by you and how much education you have, and how much knowledge you have, and how many letters you've got after your name, and how many facts and figures you can spit off the top of your head. And that's all good. I'm not saying it's not. It has its place, and it's important for many reasons. But I don't think it's the most important thing. And so maybe what I'm trying to say here is if we can, as I've tried to say in other ways, if we can have this relational exchange for the most genuinely intentional reason towards the good, then I think things are going to work out, regardless of what all the other. I think everything is secondary to that, and that to me is professionalism. So maybe what I'm doing here is just spouting off what professionalism means to Tom Lenz, and maybe that's the privilege I get out of that I have to create these videos and teach a class and those kinds of things. But I want at least for you to know that in my mind, professionalism means many, many things, and that the most important to me, though, is that relational exchange that we have with the folks we're working with. So that's my 2 cents maybe on professionalism. And what you get to do this week then, and some of you maybe have already done it, is to describe what professionalism means to you and how it fits into the daily life of a health and wellness professional, and how is professionalism perhaps similar and different in our context that we're talking about here compared to other professions. So I'm looking forward to watching your videos. Also, in addition to reading your papers on professionalism, I think that's a nice opportunity for us to be able to expand on our thoughts in this area. So I'm looking forward to reading those as well. All right, well, I will get to do this one more time in week 8, and then we'll tie this thing up with a bow and then cruise on into our holiday season. Okay, until then, talk to you soon.